The BGI tests are the standard PCR tests which are currently being used all around the world for supposedly diagnosing patients with what the world refers to as COVID-19. It involves having a swab taken from the back of your throat and then analysed by a machine to produce a yes/no result. It's important to note that these BGI PCR tests, along with others, were not subject to typical scrutiny and were rushed through the TGA on a special exemption granted by the Department of Health. PCR tests are rapidly accumulating criticism from many of the world's leading virologists and experts in the field, primarily in relation to their high CT values, which stands for cycle threshold. This refers to the sensitivity of the test. So in other words, the higher the CT, the higher likelihood the test will pick up something it considers to be COVID-19. The CT of the test in Australia are just below 40, which is considered very high. Here are some examples of what people are saying. In March, the Philippines Health Department stated that BGI PCR tests were faulty and had to be discarded. The Health Undersecretary Rosario Vergni said at the time, quote, "The test kits earlier sent to us by China showed only 40% accuracy. We will not be using these because of the low accuracy. We have put these in storage instead." In August, Sweden's Public Health Agency reported the discovery of 3,700 false positives using BGI PCR tests and made the following statement. People who had mild symptoms or who didn't feel any symptoms at the time of the test received false positive results, and that the faulty kits had been reported to the Swedish Medical Products Agency. Now, BGI responded a few days later and said, quote, "China prefers to implement stringent rules, conduct thorough tests and set high sensitivity," essentially admitting that these tests are hypersensitive in nature. An article published by the New York Times in August titled, "Your coronavirus test is positive, maybe it shouldn't be," reported on data compiled by officials from New York, Nevada, and Massachusetts. Massachusetts, coincidentally, is home to a BGI headquarters. The article went into detail about the high CT PCR tests and went on to explain that up to 90% of people testing positive to COVID-19 carried such low amounts of virus that they probably would not be contagious, and went on to explain that other tests actually indicate how much virus is in a patient's body, whereas the COVID PCR tests produce a simple yes/no answer. Here's what some of the experts are saying. Dr. Michael Mina, an epidemiologist at the Harvard T.H. Chan School of Public Health, said, quote, "Tests with thresholds so high may detect not just live virus, but also genetic fragments, leftovers from infection that pose no particular risk." He went on to say, in Massachusetts, from 85 to 90% of people who tested positive in July with a cycle threshold of 40 would have been deemed negative if the threshold were 30 cycles. I would say that none of these people should be contact traced, not one. Dr. Juliette Morrison, a virologist at the University of California, Riverside, and it's interesting to point out that California is actually a state that banned the use of BGI. She said, quote, "I'm shocked that people would think that 40 could represent a positive." Scott Becker, the executive director of the Association of Public Health Laboratories, said, "The number of people with positive results who aren't infectious is particularly concerning." Dr. Angela Rasmussen, a virologist at Columbia University in New York, she said, quote, "It's just kind of mind-blowing to me that people are not recording the CT values from these tests and they're just returning a positive or negative." Canadian MP Randy Hillier had this to say in the Ontario Parliament. Take a look.
Next question, the member for Lanark, Frontenac, Kingston.
My question is to the Premier. Our COVID policies and the risk that they pose requires an honest and forthright discussion. Dr. Yeadon, a former chief scientist with the pharmaceutical giant Pfizer, has stated, and I quote, "Most, if not all, of the PCR tests result in false positives due to high CT thresholds." Juliette Morrison, a virologist at the University of California, states, and I quote, "Any test with a cycle threshold above 35 is too sensitive." The Public Health Agency of Canada reported in May of this year that testing over 25 cycles provides dubious results. The prestigious Oxford professor Dr. Carl Hannigan has stated, a PCR test does not equal COVID-19. Speaker, my question to the Premier is, your testing creating both a false understanding of the risk as well as false positives? On July 30th, the Deputy Medical Officer of Health, Dr. Barbara Yaffe, stated, and I quote, "Our testing can result in over 50% false positives. That is, the person actually doesn't have COVID. They have something else, or they may have nothing." She has also called for limits on testing of asymptomatic people, while the government calls for more. Another contradiction in a long list of COVID contradictions. We know high false positive rates are due to high CTs, and Canadian and world experts agree it should not be more than 25 cycles. Yet, according to the Journal of Virology, Ontario labs are testing samples at 38 to 45 cycles. That's what needs to be done. Speaker, to the Premier, when did the Premier become aware of these faulty tests and practices, and why have you done nothing to fix them since at least July?
Back in June, the Doherty Institute, in collaboration with the University of Melbourne, published a report praising the BGI PCR tests. But it's important to point out that also back in June, the Doherty Institute received a US $2 billion donation from the Chinese tech company TikTok. And considering the extensive ties Melbourne Uni has with the Chinese Communist Party and the large-scale amount of funding it has received from them over the years, it's highly questionable whether or not the Doherty Institute and Melbourne Uni were acting in the best interests of Australians. In August, a team of experts from the Oxford University-based Centre for Evidence-Based Medicine published an article titled, "Are You Infectious If You Have a Positive PCR Test Result for COVID-19?" The study was focused on the relationship between COVID-19 infectiousness and PCR test results, and concluded that, quote, "Insufficient attention may have been paid how PCR results relate to disease. The relation with infectiousness is unclear and more data are needed on this. If this is not understood, PCR results may lead to restrictions for large groups of people who do not present an infection risk." On the 13th of July, the Centre for Disease Control published a report on COVID-19 and PCR tests and had this to say, and I'm reading from the report right here. "Detection of viral RNA may not indicate the presence of infectious virus or that 2019 nCoV is the causative agent for clinical symptoms. The performance of this test has not been established for monitoring treatment of 2019 nCoV infection. The performance of this test has not been established for screening of blood or blood products for the presence of 2019 nCoV. This test cannot rule out diseases caused by other bacterial or viral pathogens." The Bulgarian Pathology Association published an article on the 1st of July titled, "COVID-19 PCR tests are scientifically meaningless." It went on to say, quote, "Lockdowns and hygienic measures around the world are based on a number of cases and mortality rates created by the so-called SARS-CoV-2 RT-PCR tests used to identify, quote, positive patients, whereby, quote, positive is usually equated with, quote, infected. But looking closely at the facts, the conclusion is that these PCR tests are meaningless as a diagnostic tool to determine an alleged infection by a supposedly new virus called SARS-CoV-2. And even our very own Therapeutic Goods Administration was forced to admit on October 1st that, quote, the reliability of COVID-19 tests is uncertain due to the limited evidence base. Available evidence mainly comes from symptomatic patients and their clinical role in detecting asymptomatic carriers is unclear. The indications for conducting a COVID-19 test have changed through the course of the pandemic. Yet despite this information, Daniel Andrews and other leaders around the world are still coercing the population into getting tested and also mandating testing. You got to ask yourself the question, why? And finally, Kerry Mullis, the creator of the PCR test, who sadly passed away last year, is on record explicitly expressing that PCR tests are not designed to detect people who are sick. Take a look.
I want to ask this to Kerry. How do they misuse PCR to estimate all these supposed free viral RNAs that may or may not be there?
I think misuse PCR is not quite. I don't think you can misuse PCR. No, the results, the interpretation of it. See, if you can say, if they could find this virus in you at all, and with PCR, if you do it well, you can find almost anything in anybody. It starts making you believe in the sort of Buddhist notion that everything is contained in everything else, right? I mean, because if you can amplify one single molecule up to something that you can really measure, which PCR can do, then there's just very few molecules that you don't have at least one single one of them in your body, okay? So that could be thought of as a misuse of it, just to claim that it's meaningful. It's not an estimation. No, it's a really quantitative thing. It tells you something about nature and about what's there, but it allows you to take a very minuscule amount of anything and make it measurable, and then talk about it in meetings and stuff like it is important. See, that's not a misuse. That's just sort of a misinterpretation. The measurement for it is not exact at all. It's not as good as our measurement for things like apples. An apple is an apple. You know, you can get something that's kind of like, if you got enough things that look kind of like an apple and you stick them all together, you might think of it as an apple. But and HIV is like that. Those tests are all based on things that are invisible, and the results are inferred in a sense. PCR is separate from that. It's just a process that's used to make a whole lot of something out of something. That's what it is. But it's not. It doesn't tell you that you're sick, and it doesn't tell you that the thing you ended up with really was going to hurt you or anything like that. That's what it's not.
Dr. Rainer Fulmich, a highly accomplished lawyer and member of the German Corona Investigative Committee, is preparing to legally challenge the World Health Organization and other key global players for the damage caused by PCR test-based government policy.
The three major questions to be answered in the context of a judicial approach to the corona scandal are: 1. Is there a corona pandemic, or is there only a PCR test pandemic? Specifically, does a positive PCR test result mean that the person tested is infected with COVID-19, or does it mean absolutely nothing in connection with the COVID-19 infection? 2, do the so-called anti-corona measures, such as the lockdown, mandatory face masks, social distancing, and quarantine regulations serve to protect the world's population from corona? Or do these measures serve only to make people panic so that they believe, without asking any questions, that their lives are in danger, so that in the end, the pharmaceutical and tech industries can generate huge profits from the sale of PCR tests, antigen and antibody tests, and vaccines, as well as the harvesting of our genetic fingerprints? Not only are PCR tests expressly not approved for diagnostic purposes, as is correctly noted on leaflets coming with these tests, and as the inventor of the PCR test, Kary Mullis, has repeatedly emphasized. Instead, they're simply incapable of diagnosing any disease. That is, contrary to the assertions of Drosten, Wheeler, and the WHO, which they have been making since the proclamation of the pandemic, a positive PCR test result does not mean that an infection is present. If someone tests positive, it does not mean that they're infected with anything, let alone with the contagious SARS-CoV-2 virus.
It's really important to keep in mind that all the destruction and the loss of our civil liberties can be directly attributed to government policy, which is based on nothing more than PCR test figures. So should these PCR tests be proven to be completely useless and meaningless, it's only fair and reasonable that those who are responsible for enforcing this policy are brought to justice. And you have to ask yourself the question, who stands to benefit the most from manufactured, inflated PCR test results? It's certainly not the people. The people have suffered greatly. I think the answer is quite obvious. The world's multi-billion-dollar biotech and pharmaceutical companies benefit greatly, as do the world's power-hungry politicians.